Hello, and welcome to my pre-recording for the 2025 Human Anatomy and Physiology Society Virtual Conference Workshop. My name is Dr. John Roufaiel, also known as Dr. Roofs or Professor Roofs. I'm going to be discussing the use of artificial intelligence in education, specifically involving human anatomy and physiology. Please allow me to share my presentation. The title of my presentation is Teaching with Artificial Intelligence, How to Build Better Thinkers, Not Just Faster Answers. Here's the outline that we're going to be following today. I'll begin with an introduction, a little bit about myself, and then what we will be discussing. We'll get into a little bit about understanding artificial intelligence and what it is. Everybody has a different understanding, so this will just help to establish a common ground amongst us. We'll get into prompting strategies. AI is not the same thing for whatever you put into it. AI will be dependent on what you put into it. So the way you prompt it will be what it gives you. We'll get into a little bit about active learning with artificial intelligence in terms of examples. Then finally, the ethics about it and how we can incorporate it into our institution. And finally, preparing for the workshop and takeaways. So hopefully my goal will be able to get some interest so that you can enjoy to join me. I believe that will be on October 18th from 2 to 3 p.m. Eastern for the live workshop session. Beginning, we'll get into the introduction. So again, my name is Dr. John Roufaiel. I have a medical doctor degree from Ross University School of Medicine. I did my clinical rotations in Southern Florida, specifically in the Miami and Fort Lauderdale regions, and also in New York City around Queens. My residency was in Syracuse, New York, at SUNY Upstate Medical University, where I did family medicine. As well, I have two masters, where there I got my master's of science in anatomy, and then I got my master's of public health from the University of Florida. I have approximately 15 years of experience as a professor and tutor and teacher. I started off in the community colleges, making my way up through undergraduate to graduate, health professions, and medicine. So I have taught physician assistants, nursing, PAs, allied health professions, MDs, and DOs. Throughout that time, I made a YouTube channel, and as you can see, it's called Prof. Roofs, Prof for Professor. And my last name, if you take a look at it, it is Roufaiel. So Roufaiel, if you were to shorten it, is Roofs. So I have my pen right here, if you could see it coming up. But Roufaiel, my students just thought about like what's above your head, and they wrote roofs like that. So that's where you get Professor Roofs. I have got about 15,000 subscribers, 2 million views, but I've only made about one or two videos a year. And that's something I'm passionate about and I'd love to get back into. I've also made some medical applications. They were free, just trying to put some stuff out there. I enjoy, playing with the technology and seeing how it can help others, which were downloaded about 10,000 times. So as you can see, my background here is in pretty much medicine, healthcare, education, anatomy, physio and technology. My disclaimers is that I have no disclosures for this workshop. The opinions that are expressed are mine. They do not reflect my previous institutions or the Human Anatomy and Physiology Society. Any products mentioned are meant as examples and not as corporate endorsements. So even though I may mention some products, these are just used as educational examples, and in no way do I benefit by discussing them. Now, getting into the workshop, what you'll learn in this workshop, why AI is transforming health science education, how to change generative AI into a thinking partner. So it's not that it's going to replace you, but again, the key word here being partner. So you'll see my pen come up. I just try to find a location as I go along, but I like to use it because it tends to highlight things. So it's going to be a partner. Crafting better prompts. It's all about the prompts for deeper learning, what we tell it and what we expect to get from it. Common pitfalls, ethics at the end, practical tips, and then we'll get some hands-on practice in designing and revising AI prompts if you join me in the workshop. We'll talk more about that at the end. Generative AI in everyday life. It's used in hospitals, clinics, and classroom. You can see the example up here. You can see the robot taking a look at the X-rays. So it's being discussed, being used in radiology in comparisons to, how they work and collaboration of radiologists and AIs in reading it. I've personally used it myself, trying to see if, an AI could have the same interpretation. And it was for a fracture in the foot, and both the AI and myself got the same result. So I did personally try one program for one attempt. Assisting with documentation, triage, and charting. That's a huge business sector right now. You'll see there are various programs out there. One that I recently came across was Suki. I don't know much about it, but I did see that there are several out as well out there you can find. But they're just basically involved in documentation because several hours are used, if not every day, but every week by physicians just to take notes. So by listening to the conversations, that the AI can, hear your voice as the healthcare provider and then the patient, and then, help to write it in the proper format or the format that you wish. Also helping to triage and diagnose as well too. But again, not as a replacement, but as a partner or an assistant. Students are already using it, so why not be there to guide them how to use it properly? Education must adapt, as always, even as we got into the technology area and we got computers and they're online and there's Google, we're always adapting in how to use it. So instead of, limiting students, why don't we teach them how to use these things properly? Now we're moving on into understanding what is AI at a very brief level as it relates to us here. AI is more of a mirror. It's not a mind. So whatever, you're putting into it, it starts to mimic it and then starts to learn a little bit from it. It's a tool, it's not a replacement. So again, it's something there to assist us, just like if there was a textbook or if there was the internet search engine, whether it be Google or Yahoo or something, it's not to replace, but it's just another tool. It doesn't think like we do, but it imitates patterns in data. So, we start to give it things. We might say machine learning, but it's still not at the same level as human learning. But, they are making progress to try to approach that. It lacks context, lacks judgment, empathy, and experience. And again, these are things people might want to argue, but it's being taught it. You might even say a machine knows more empathy than a certain human, but, overall, these are still more human traits. Human insight plus AI pattern recognition can produce stronger outcomes. So again, we're trying to say this is a pattern. What we can take as humans and combine it with what AI can provide, we can produce better outcomes, whether it actually be in our own lives or in this case in education. So students must learn to verify, not just to trust. So again, AI is not 100%. It's not a replacement. It's helping to be there as another source so, we can assist our students to know how can we verify the information that the AI is providing to us. Behind the curtain, what makes AI so-called smart? Well, it's trained on massive data sets. There's a large language model that has lots of textbooks, websites, forums. It's able to search so much. AI is able to learn from other AI. I believe there was a movie with Will Smith called I, Robot, where he's like the robots are teaching the robots. It predicts the next word, not necessarily the correct answer. It may not always give you the correct answer. Sometimes I've seen in practicing medical questions, it hasn't given me always the right, answer. And I'd always have to go verify by peer-reviewed sources. No awareness of the truth, the context, or recent events. Again, that depends on the model and the version. Some are up to a certain date. It might even tell you, I only cover up to this date, so I may not know like what just happened today. Output depends entirely on input. That takes us to garbage in, garbage out. So if you put garbage into it, pretty much garbage will come out to it. But if you put in, so again, if you're giving like something very vague, you're going to get something very vague. But if you're putting something that's more specific, you'll get more of a focused response. So for example, my wife is an amazing private chef. And, if, I said, for example, I want a recipe for chicken soup, right? And it could just give me a whatever recipe for chicken soup. But, her as a private chef, she says, I would like a, gourmet recipe for chicken soup. I would like to make it, a delicious broth that has this flavor, maybe give it a French twist to it or something like that. Whatever that French twist is, I have no idea. It would give you more of a focused response. You must tell it audience, tone, level, format, scenario. So medically, who are we talking to? What's the audience? Are we talking to fourth graders? Are we talking to high school students, college students, medical students? What tone are we gonna, be looking at? What level? what format, where are we, the scenario, are we in an emergency room, are we in a classroom? So there are a lot of prompts you can put other than, just, make me a question about this or tell me about this patient. There's a lot of things to consider. You have to give the AI the environment, the picture. It's in your mind, so it's about taking it from your mind and giving it to the AI. Teaching students to ask better questions is the goal. So, basically talking about some of these things here. How can we prompt our student to say, for example, this person has chest pain, what's their problem? All right, well, is it a female? Is it a male? What's their age? Is it going to be muscular? Is it going to be a heart attack? So, how can we better help our students? And also, how can we get the AI to help our students as well, too? Moving on now to prompting strategies. So you've heard me talk a little bit about different prompts, things we can give the AI, prompt it or start it to give us, more insightful answers. We can start with a patient case, not the topic. For example, if we're talking about the GI system, instead of talking about the lining of the GI system, we can mention a 26-year-old male who consistently drinks, who has upper abdominal pain, right? So then a student can say to the AI, why did my teacher give me this situation as it relates to the lining of the gastrointestinal or the gut lining of the stomach? And it will get into it and it'll talk about acid production and the mucus barrier. And the student continue to ask more questions like, what else do you need to know? What else do I need to know as it relates to this? Why is this important? Give me a differential diagnosis. Is it just an ulcer? Could it be something else? Could it be, a problem with the skeletal system? Could it be a heart attack? What could it be? So we're modeling what's called the Socratic questioning as we go in deeper and deeper and ask ourselves why. What's the reasoning? Okay, this is what you think. Why do you think that? Can you change your answer? Could it be something else? So, we're going on and trying to become more insightful, gain more insight into what is going on. So as we're doing that, we're going from pretty much recall, just remembering and memorizing, to applying it, adding it to a situation. So instead of, for example, just labeling a diagram, if we're in the anatomy lab and we're rotating, the supraspinatus or rotator cuff muscle, we can predict the consequence. What if I'm lifting weights, or what if I tear, this rotator cuff muscle? What if I tear my supraspinatus? What will happen to me? Why will it happen to me? And as you learn that, you're starting to learn the action and the function of that muscle and what it does. Does it help with elevation at the beginning? Does it help with elevation at the end? So you get into more complex and more detailed things. Prompted to create analogies and diagrams or mnemonics. So, for example, make me a diagram of a ruptured supraspinatus muscle, or take a picture of it in the anatomy lab and say, what would it look like if this thing was ruptured? Mnemonics or memory aids. We're always telling our students go look them up, or we're trying to make them up, or we're using the same ones over and over again. But the AI can help them come up with new ones, the ones that apply to them, because not all mnemonics work for everybody. We can help it to make them questions, whether it be multiple choice, fill in the blank, or messaging. Yes, we can use it to make exams for them, but these are important for students to make as well too, as making questions and practicing them and understanding the right and wrong answers is very important, has been proven in learning. If you take a look at my poster presentation for this conference as well too, you'll see that I mentioned and discussed this as well. We got to customize it by the level. Who are we addressing? Who are we trying to teach? Are they high school students? Are they undergrad? Are they nursing students? Are they pre-med? Are they allied health? Are they medical school, DO, MD, whatnot? So, these are very important things we got to consider when we're talking to it. For example, taking all this into consideration, you could tell the AI, make me a undergraduate or actually a nursing school level question based on the GI system, on the lining of the GI system, multiple choice, and four answers, right? That'll be completely different than somebody at the level of middle school, for example. So these are things that we're talking about prompt and how we can change it and make it more specific. Build, revise, deepen. How can we make it better? Start with something basic, as you see here. What is blood pressure? Okay, it's very generic. All right, so we're learning about blood pressure. There's a top number and there's a bottom number. What are they called? Systolic, diastolic. What do they mean? How can we go and take it step by step? How can we go into more detail? Okay, what happens to these numbers if somebody is dehydrated? What happens to these numbers as somebody gets older? Why did these things happen? Ask for comparisons, explanations, alternatives. Okay, if it says for some reason it can go down, okay, well, what caused blood pressure to go up? So you're starting to get into more depth and starting to give explanations. These, trigger discussions. Does it agree with what you think? The AI could say, tell me what you think first, and then compare and see. So there's so many different approaches to how you can go into to more depth here by building and revising your question. Here's an example. And what I'm actually going to do here is try to do a live example with you. I've given you already a script that's written here. And, feel free if you want to stop the video and read the script, you can do that. But I want to try to do this with you here in a live session. And I hope you can hear what it says. What does the small intestine do?
The small intestine is basically your body's nutrient absorption superstar. After food leaves your stomach, the small intestine is where all the real magic of digestion and absorption.
Okay, it's going to keep going on, right? It likes to give a long example. But how can I prompt it and be more specific? What does a small intestine do? Can you give me a one sentence example that will be appropriate for a community college anatomy and physiology class?
Absolutely. Here's a nice, concise example. The small intestine is the primary site in the digestive system where nutrients are absorbed into the bloodstream. So it's basically the body's nutrient absorption powerhouse.
Okay. Now, which part of the small intestine absorbs iron? Can you also give me a one sentence response?
Of course, in one sentence, iron is primarily absorbed in the duodenum, which is the first part of the small intestine right after the stomach.
Okay. So you can see you can have conversation and you can see exactly it's not word for word. Everything that you ask, it could be 100 times. You could get 100 different variations, but hopefully similar. So that's why it's important to go to check to have discussions. You can see how I changed the prompt and I got more specific answer. So, these are just examples. Again, you can pause the slide and read through. You can also try this on your own as well too. And these are things we will practice when we get into the workshop. Now moving into active learning with AI. So with active learning with AI, we're going to generate, take, explain, and improve. Students will generate their own quiz questions. Just ask them. Say, can you make your question? What if they don't know how? Ask the AI to teach them, hey, how do I make a better question? And the AI can, teach them. So it's almost like a teaching assistant that helps you. All right. So make their own questions. Then take a quiz. Critique the AI's explanation. Is this right? Can I go in the textbook? Can I find explanations that match it? And why was this answer correct? Why were the other answers, if it was multiple choice, why were they incorrect? Because the incorrect answer this time could be the correct answer next time. Reinforces retrieval, metacognition, and critical appraisal. Works great in study groups or flipped classrooms. So if you can get in groups with people and everybody will ask a question in a different way and everybody can practice everybody's question, it gets everything going until everybody starts to feel more confident and understanding and in agreement. And then, bringing it back to you as an instructor and discussing that topic more. So flipping the classroom with prompts. Assign students to create a prompt and an AI output. So what you can do is say, okay, students, um, I'm going to assign you a prompt. Okay. So, you tell the AI, teach me about the lining of the GI system. And, the AI will produce some output. And then the peers will evaluate. Does this seem right? Is this clear? Is this correct? Can we find this in the textbook? Does it make sense? Is there any bias here for some reason? How relevant is this to us? Is this something that's too high? Is it like a medical school level and we're at community college level? Is it too low? Should we be learning more detail? So we have to evaluate the relevance of this. Encourages collaboration, working together, skepticism. Let's go validate this. Does this make sense? And creativity. Can we make this a little bit more creative instead of just, straightforward? Maybe it's a little bit bland. So you can do this in your classes. You can use lab groups. If you're online, you can make breakout groups, you can make discussion forums on Canvas or Blackboard or whatnot to help discuss and go throughs and generate, very good discussions. Now that we've learned a little bit, about how to use it, how to prompt into it, let's talk about the ethics. So we always say we have the ability to use it, but have we thought about should we use it? Right? We can, but should we? And how? So teaching AI ethics in the classroom, talking about privacy, confidentiality, no, private health information. So you should not be copying, somebody, let's say Jane Doe, first and last name and, the age and, where they live and everything, because all these things together can be their identifying information. So teaching them and say, there is a female, she's 42 years old. This is her medical history. This is what's going on, right? We can't tell exactly who this is just based off of that. That could be anybody. So, helping to understand, not to use that stuff. Plagiarism, just copying and pasting. There's also now software that can realize, was this copy and pasted made by AI? So there are that type of software as well too. But the main thing we don't want to do is over reliance. Don't just getting stuck on AI gave me the answer and this is exactly what it said. We want to teach the students how to use the AI to teach them, to understand, to think critically, because in the test they're not going to have the AI with them. So how can the AI be used to help them to understand, to relate? For example, somebody's a mechanic, say, I'm a mechanic and I want to learn, how the heart functions. Can you tell me something similar to the car that the heart can relate to, and going from there. So relaying it to them, that's more understandable because when they get it and that light bulb goes off, now you'll see the improvements and the satisfaction. Distinguish between brainstorming versus final answers. So again, the AI can help you to think of questions or to think of answers. But, is this the final answer? Can we go deeper into it? Can we refine it? So, working with your instructor, working in groups, this can help you to, also peer-reviewed studies coming to final answers. Model integrity. We always want to be a role model. So if we're using the AI to make questions in tests, but we're telling the students they can't use it, that's not, the best example of being a role model. If we make a mistake and we labeled something wrong, admitting that and saying, oh, it looks like I made a mistake. I labeled that wrong. Let me correct it. So, always modeling that integrity and that transparency. That's always good in general, just to have in the classroom. Trust but verify. So, we like to read it and we like to trust it. But again, let's just make sure this is correct. Let's get into the habit of it. Because, for example, there was a case, I read about it, that I believe it was a law firm with some lawyers. They had to respond to the judge about something, and they just put it into the AI. I'm not sure if it's ChatGPT or another AI. And then, it wrote something and then it quoted certain cases, law cases. And when the judge received it, the judge looked at it and said, these law cases you're quoting have nothing to do with what you're discussing. And, it was a lot of back and forth going until, they had to admit it, that they just copied and pasted from the AI. And these are attorneys. So, we always want to verify, not trust it, because even in my own experience, I would realize, for example, ChatGPT will quote a publication, but then it will go and then you'll see that publication has nothing to do with it. So, there's definitely fallacies with that. So it can help you find stuff, but you always have to go and you have to verify, is this information correct? So cross-check the AI responses with textbooks, especially PubMed. Teach the students how to spot inconsistencies, something that might not make sense, something that might disagree with the textbook or, your teachings. Encourage them to bring discrepancies back for discussion because that can help other students as well too, in order to know, how can I find these discrepancies and how can I go about doing it? Aligning AI with course objectives. So again, the AI is not meant to replace something such as your course objectives, but it's meant to align with it or to go with it, to help with it. So if you have a course objective saying, learn about blood pressure, we say, okay, well, use the AI to learn about blood pressure. And we could discuss more specifics about that as well too in the workshop. Integrate into a flipped classroom style. So if you have a lab, say, okay, we have some lab questions, use the AI, help to understand it, help to learn it, help to know what we're going to be doing. And then because we're going to discuss that when class starts. So, it helps to give them that reasoning. And, if students do their work, you'll realize that, and the AI will help them. So it's just like anything, whether it's AI, whether it's a video, if the student puts the work and the effort into it, you'll see it when they get into class. And sometimes they just don't know how to use it properly. So that's why, we're being educated ourselves, I'm always trying to see how I can do it better to help teach them how to use that tool. Communicate clear policies, what you can use it for, what you can't use it for. Obviously, you won't have it in exams unless, you have some sort of, maybe a bonus. You'll say, hey, you got a bonus, you can use it, find some way creative, something like that. Encourage faculty collaboration on practices. So talk amongst your faculty when you have meetings, say, hey, this is, what I was thinking. Can we try applying this, something within the department? So things you could bring up, within your department. Now, finally preparing for the workshop and things to take away from this pre-recording, getting ready for the workshop. So what I'd like you to do, and I'll have a worksheet available for you that you should be able to download from campus, and we'll mention it, is, bring a sample topic with you. Even if you don't write it down, think about it. What are you teaching in class? What's coming up now? Are you talking about the cardiovascular system? Are you talking about a certain aspect of cardiovascular system? Is there something that the students always have a tough time getting? Maybe there's a tough time you have relaying it to you. Think about that. And then, take it to the AI and discuss it with the AI and see what the AI can come with, because we'll practice writing and revising prompts in the groups. So come with some of them. Come with some of the prompts that you gave the AI and what the AI told you and how you can incorporate it. Maybe you can incorporate it into a class even before we meet. We can discuss, how did it go? What were their thoughts? Compare AI outputs for clarity and depth. We can discuss, how clear is this? Is this in depth enough, or is it too in depth? We'll discuss the bias, the ethics, and classroom strategies and how we can improve. So the AI model is what we say Socrates or Socratic questioning and practice testing. So again, it's questioning us about ourselves. Why are we taking this answer? Is this perfect as it is, or should we not accept it? Why should we not accept it? What else could this be? Okay, now that we've done this, does our answer change? Why does it change? And continuing that cycle until we start to learn more and more about whatever topic that is. Effective prompting will deepen as a result. This is not shortcut, but it's going to deepen our learning by continuing to go further and further using the AI and verifying what we get, discussing with peers and discussing in the classroom. Verification builds evidence-based thinking. So I encourage you to come to the live session. It will be Saturday, October 18th from 2 to 3 p.m. Eastern. Again, we will be practicing designing prompts with real teaching examples. So whether you bring them to me or I can bring some that I've used as well too, we will compare and refine the AI generated responses together. So whatever you have, we can compare it. We can make some prompts up in the workshop. We can break up into groups. We can see what each group did. So we could talk about, for example, again, the GI system or the blood pressure and see what each group came up with using their AI, how they prompted in the AI, and see if we came up with same, examples or difference. Explore how to use AI for deeper reasoning and engagement and leave with a prompt design toolkit. So I'll be able to help put a toolkit together so that when you leave, it will be something that helps to summarize so that you can take it and apply it and use it in your own classroom. So thank you. I used AI to design that model right there. It took a couple, prompts to finally get it. As you could tell, I had to say, take this image. I actually started off an image with me just sitting with a hooded sweatshirt. And I said, hey, remove the hooded sweatshirt, put a presidential tie with a white dress shirt and a dark navy suit, which is actually what I'm wearing right now, and make half of myself AI and the other half, as myself, but a little bit computer generated. And it actually came out pretty well. So, I said actually put some AI background as well as a dark blue and black. So you can see all the prompts I had to put in just to get into that image. So doing that in medicine makes a difference. So, that those are things I want to share with you and how we apply it. If you need to contact me, first of all, here's my YouTube channel and here's my email. Feel free to email me, john@physiostasis.com. This was my medical education company that I use for tutoring as well too, and designing videos. It's just a combination of physiology and homeostasis together because life basically is a balance of the functions within our body. All right, thank you, and I hope to see you soon within my workshop. Yes, I just wanted to add, thank you so much again, and hope to see you in that workshop. Take care. Bye-bye.